Dr. Ladle, cancer experts like you all over the world are grappling with the same puzzle for decades now. How do you target and kill the cancer cell while sparing normal cells? Can you tell us how far we have come in pediatric oncology?
I guess in pediatric oncology, it kind of depends on what disease we're talking about. But the one of the hallmarks, I think, of pediatric cancers is that most of them grow pretty rapidly, um, as opposed to some adult cancers where they progress slowly and don't grow quickly. So because pediatric cancers grow so quickly, they most of them are quite sensitive to chemotherapy. I think as a result of that, chemotherapy has really become the backbone of a lot of cancer therapy for pediatric tumors. Where we are currently is that we're actively working to understand maybe what would be the Achilles heel of each individual cancer. We certainly know that it's not the same for all cancers, that just about every cancer is unique in itself. But are there specific mutations, or we call them driver mutations, so a specific genetic change that's really causing the cancer to form and to develop, and then can we target those specific problems, and then we can get away from just treating a dividing cell versus a not dividing cell. We would be treating a cell that has a specific genetic defect, and that should be limited just to the cancer cells. For instance, for leukemia and lymphomas, there's quite a few drugs that would be antibody drugs that would target just cells that express a certain marker, and that would allow you to use an antibody infusion to target those specific cells. Now in pediatric leukemia, there's the engineered T cells, the CAR T cells, and those are engineered to target a specific marker on leukemia cells. And in the solid tumor world, it's therapies are still being developed, but in, for instance, neuroblastoma, there's an antibody infusion that specifically targets neuroblastoma cells, and some are being developed for tumors that have a specific genetic change. For instance, in Ewing sarcoma, there's a very specific genetic change that makes it a Ewing sarcoma, and we know what that change is. We just have not found a great drug